Good evening, my lovely people. Welcome to my YouTube channel, and today we are going to continue with our discussion about the fibroids and the treatment modalities which can be used to treat fibroids. Today we are tackling SUBSEROSAL fibroid treatment. And before we continue, guys, for those who have not subscribed yet, please consider doing so, and let's make this channel a success. Continue keeping the support on. So let's talk about the treatment for SUBSEROSAL type of fibroid. The first mode of treatment is what we call hysterectomy. And what are the types of hysterectomy? One, we have total hysterectomy. This is whereby there is the removal of the uterus and the cervix. Removal of the uterus and the cervix. Number two, we have subtotal or supracervical hysterectomy. This is whereby there is removal of the uterus but the cervix remains intact. Note this, surgeries that may be performed along with hysterectomy include, there are other surgeries that can be performed for various reasons or for different reasons along with hysterectomy. Number one, we have oophorectomy. Oophorectomy refers to the removal of one ovary or removal of an ovary. Number two, we have bilateral oophorectomy. This is whereby both ovaries, for various reasons, are removed. Number three, we have bilateral salpingo-oophorectomy. This is whereby there is the removal of the fallopian tubes together with the ovaries. Note this, these secondary surgeries are not always necessary. Removal of ovaries along with uterus cause menopause to begin immediately. Another point to note, while hysterectomy is effective because of its physical and physiological risks, National Institute for Health and Care Excellency (NICE) recommends that it should be considered only when one, other treatment options have failed. Number two, other options are contraindicated to that various patients. Number three, other options are declined by the patient or the person having the fibroid. Number four, person with the fibroids requests it after being fully informed about the procedures and the risk. A person may request this kind of surgery or this kind of treatment after being explained and informed about the risks which can occur during this kind of a procedure. Next point, a person with the fibroid who does not wish to retain their uterus and fertility. So another type of a person who may be recommended for this kind of a procedure is a person with the fibroid and who does not wish to retain their uterus and fertility. Let's get to the next mode of treatment, whereby we will be discussing about myomectomy. What is myomectomy? Myomectomy is a procedure that involves removal of uterine fibroids but leaves the uterus intact. The fibroids are removed but the uterus remains intact. What are the benefits of myomectomy? One, the uterus returns to its normal functioning. Uterus returns to its normal functioning. Number 2, pregnancy is possible, or a lady will be able to get pregnant again. Number 3, periods return or remain. Anything that has advantages must have its own disadvantages. So, what are the disadvantages of myomectomy? 1, it needs the disadvantages of one of the disadvantages that fibroids may grow after the removal, or they may recur. So the fibroids might be removed and then they might recur again. Number 2, surgery itself takes longer than hysterectomy. It takes longer time than in hysterectomy. Number 3, there is more blood loss in myomectomy compared to hysterectomy. Number 4, it takes up to 6 weeks to recover, so the recovery time is a bit long. Number 5, possible risks and future pregnancies. For example, cesarean section, depending on how deep the fibroid were and if they spanned larger part of the uterus. I hope you got that point. Possible risks and future pregnancies, for example, cesarean section, depending on how deep the fibroid were and if it spanned larger part of the uterus. This marks the end of our first video today, and in our next video we are going to discuss about the types of myomectomy. Guys, let's keep the support on. Let's continue supporting this channel, and I do appreciate the far you have taken it. Have a wonderful evening.